We found that there are 4 areas of testing in particular that unite us in the dental office and in the non-dental medical office. And it starts with blood work. So just these 4 numbers, and there are many more, but if we just focus on myeloperoxidase and plaque 2, these are 2 markers very specific for inflammation in the wall of the artery. And if those are inflamed, we absolutely have to talk to each other from the dental office to the non-dental office in order to resolve this inflammation. hs-CRP is a more global marker of inflammation. It may or may not indicate that the inflammation is occurring in the oral cavity. It could be due to a whole host of things, but at least hs-CRP is being measured more and more in the conventional practices and is being recognized as, yes, we ought to start looking at inflammation, as it does play a role in cardiovascular disease and in heart attack and stroke. And then microalbumin creatinine ratio is a urinary test that can help us determine if there's vascular disease in the renal arteries. And again, we need to have conversations starting with at least myeloperoxidase and plaque 2, and how are we going to resolve it in the dental office? How are we going to resolve it in the non-dental office for the patient that we're both looking at together? And then secondly, when we look at arterial wall health, this is just one way to do it. Maybe you've heard of the ultrasound of the carotid arteries in the neck. We can do a very nuanced, minute look at the area where plaque lives in the carotid arteries. Yes, we want to know if there's impairment in blood flow, but way before there's blood flow problems, we want to know, is there inflammation and infection festering on the wall of the artery in the form of plaque? And we can find that by using ultrasound of the carotid arteries, specifically CIMT, because that means carotid intima media thickening. We want to know if that intima media looks healthy or it's starting to show evidence that there's plaque formation there. And then thirdly, the sleep test. Of course, we have to collaborate together on the sleep test. Most of the things that we see, whether it's upper airway resistance or it's sleep disordered breathing of any kind, or even classic sleep apnea, requires the dental team and the non-dental team to work together to get the right diagnosis or diagnoses and then treat that appropriately. And then lastly, our saliva test, where we identify these 5 dangerous bacteria that have undoubtedly, numerous studies tell us clearly that these are not just contributory, but causal of heart attacks and strokes and other vascular diseases. There's no way that I can resolve these in the medical office alone. It takes this collaborative effort. What else would you say about the way that getting this testing and the way our conversations and our care of the patient has changed, Laura, from collaboration?
Yeah, I think this is the number one question people ask. How do I collaborate? It's right here. It's this objective. These are 4 objective ways to look at a patient rather than just a subjective view, like my patient's okay, there's no bleeding and bucketing. So really, this is that better measure that we are objectively able to talk about minimally these 4 tests and create that merged treatment plan.
Yeah, so together we're creating healthier patients and healthier practices. We won't be talking about the business structure or the profitability aspect on this call as much, but there is an entire course on that we will get to in future courses. But today we want to talk about working together to keep people out of the cath lab, to keep them out of the emergency room, to keep them healthy and create health for them, rather than setting them up for this future that no one wants. It requires integrating medicine and dentistry. And so we've created the Clarity Blueprint to take not only ourselves in our practices from a healthcare standpoint, from confusion to collaboration, but to take our patients through this same process. And the way that Laura and I came up with this is the fact that we kept seeing patient after patient that was confused about either why they had the heart attack or confused about whether or not they were protected from having their first heart attack or stroke. For example, an individual that's, say, in their 40s, and they start to think about, could I have a heart attack lurking in my future the way my father started down this path at age 50 or 55, or the way that I saw my grandparents suffer? People, before they've ever had a problem, begin to think about these things. And they either think they've had a thorough evaluation or that they're standing on good data that they are protected. Or they're confused because they just say, well, if it happened to my father, it's going to happen to me. They think there's nothing that can be done, and nothing's further than for them from the truth. And Laura and I've just explained to you how there's healthcare confusion because we're still relying on old data, on old measures. We're not using very precise ways to determine, is this individual looking at us today in the operatory in the dental office or in the clinical exam room in the medical office? What's going on inside of them at the cellular level? Are they headed towards a heart attack or are they protected? And we can know that today with these measures. And so we have to understand infection and inflammation, as we're going to teach you today, in order to do that. And then we have to collaborate on the topics. So we have to get clarity. And then we have to go back to that slide one more time, Laura, before we get to this. I just want to say we have to get clarity around that, which is understanding what's been missing. And then we start to work together to get some competence. After your first 5, 10, 20 cases, then you're going to say, oh, I see now. I see how this is so much more powerful and effective than just checking, as I was doing, blood pressure and lipids and send you on your way. And then you get that confidence to say, I know this is the right thing. I can see patients losing weight and feeling better and creating health, and they haven't had another heart attack, or their numbers are all where they need to be. And then fifthly, then that we bring all of that to the collaboration. And there's where the power team occurs, is when there's a dental team and a non-dental team working together with this confident approach and collaborating together. That's how we're going to take heart attack and stroke off the #1 killer spot and help people have the longevity, the health span for their many, many years to come that they want.